I'm Honorable Dr. Yusuf Tanko Sununu, member representing Ingaski, Shanghai, Yauri Federal Constituency. Mr. Speaker, I'm from Kebbi State. I rise to request the honor of this House to suspend the relevant rules allowed me come under Order 8, Rule 4, to present a motion of urgent public importance calling on the federal government to ensure protection of healthcare personnel in the midst of a COVID-19 pandemic and to ensure payment of outstanding salaries of federal capital territory health workers. Thank you. Honorable Dr. Samuel Babatunde Adejare, Honorable Pascal Obi, and Honorable Martins Oke to present a motion of urgent public importance calling on federal government to ensure protection of healthcare personnel in the midst of corona pandemic and to ensure payment of outstanding salaries of federal capital territory health workers. Mr. Speaker, sir, the House notes that COVID-19 pandemic has proved to be the greatest challenge to human existence globally. Currently, the spread of infection is not only alarming, but also the mortality world over has never been anticipated. Coupled to that, world economy and social relations are almost grounded. This has negatively affected global access to healthcare services, resulting in increased death from other causes, further compounding the fight against COVID-19 pandemic. Globally, over 4,425,485 cases, people were affected, with 302,059 deaths as at 16th of May 2020. This made the World Health Organization to call on nations with weak health systems to prepare for a very shocking experiences. Currently, community transmission in Nigeria is not in doubt. However, the rate of infection among healthcare providers is not only alarming, but capable of retarding the success so far recorded. The House worried that no country can be at war and be comfortable that its foot soldiers are being threatened by enemies, and so the need for concerted effort to protect the fighting forces cannot be overemphasized. So far, over 160 healthcare professionals nationwide are infected, with many deaths recorded. As it is today, the patients are afraid of going to hospital because of the fear of acquiring the infection from healthcare providers. So also healthcare providers are scared of interacting with patients due to poor access to personal protective equipment by healthcare providers. To further compound matters, irregularities of salary payment, consequent poor implementation of RPPIS enrollment in federal capital territory. There was a notice of commencement of indefinite strike by the federal capital territory health workers with threat to withdraw all their members from the isolation camp and to commence indefinite strike on the 28th of this month. Cognizant of the sacrifices being made by healthcare providers in the fight against COVID-19, the House, through Mr. Speaker, intervened on the 17th and 20th of March that made the resident doctors suspend their week-long strike before the commencement of lockdown. Further cognizant of the negative impact of the strike, not only on the fight against COVID-19, but on the overall healthcare delivery, and in the spirit of the fact that a laborer deserves his wages, it becomes inevitable for the House to further act. Worried that in the initial intervention, only consequential adjustment of House officers' salary was achieved. The House viewed the failure of RPPIS to adjust correctly the federal capital territory administration staff salaries as unacceptable, and most especially the wages of forces working day by day to combat COVID-19 infection in the country. To further make matters worse is for the properly appointed staff in the Federal Capital Territory Administration to stay for 5 to 7 months after assuming office and regularly reporting to duties without receiving a penny as his or her wages. The morale of such professionals to serve as a frontline staff in ongoing fight against COVID-19 is better imagined. The House therefore resolved to direct Presidential Task Force on COVID-19 to urgently procure personal protective equipment for distribution to hospitals. 2, in addition, to also use the House of Representatives contribution to procure personal protective equipment for distribution to public hospitals in order to protect our healthcare providers. Third, the House also directs Federal Ministry of Finance, RPIS, to rectify all anomalies associated with the payment of Federal Capital Territory staff and to ensure payment of accumulated salary with immediate effect. Also, the House commended the Federal Capital Territory health workers, healthcare providers, and urged them to further continue with their commendable sacrifices as House continue to intervene. The House also resolved that the leadership should convene an emergency meeting tomorrow with Federal Capital Territory Minister, Minister of Finance, DG Budget of the Federation, and RPPS official tomorrow to immediately rectify all the anomalies. And finally, direct the House Committee on Healthcare Services and Health Institutions to ensure compliance. Mr. Speaker, I so moved.
We've all been talking about those in the isolation centers. But before you get to the isolation center, you must get to a hospital first. And a lot of them have been affected by COVID-19, and they don't have masks, they don't have protective gears, and your motion is to make sure that this is done. And second, and almost more important, if not just as important, if not more important, is that the FCT health workers have threatened to go on strike on the 28th of May. The reason being that they have not been paid their salaries since January. We're talking about 5 months. It's almost embarrassing to sit here and be talking about health workers not having been paid their salaries since January. And they have threatened to go on strike on the 28th of March. Of May, I'm sorry. They had earlier threatened to go on strike. Luckily, the leadership was able to, and the House of Representatives was able to ward that off. That's why I said it's embarrassing that the promises that were made at that time have not been kept. And it's important that we take this very, very serious. That's why I thought it was a matter of urgent public importance. Because we all know the dire consequences come 28th of May. If the health workers, the nurses, and all of them down their tools, this is a very inauspicious time for anybody to do that. But you can only appeal to people, for so long. They have families as well. So it's important, and I think it's because of this IPPIS system why they are finding it difficult to pay them. So as you rightly said, we'll invite the minister, the FCT minister, and the Minister of Health, Minister of Health and Finance to a very crucial meeting tomorrow. So we'll just put the question. I just need to underscore what he has said. Those in favor, please say aye. Those against, please say nay. Ayes have it.